Abnormalities known as shin splints are expressed in pain in the front part of the lower leg. The medical term for shin splints is medial tibial stress syndrome. Shin splints start as delayed onset muscle soreness. These symptoms are common among runners, hikers, basketball players, etc. Not only athletes, but many people might experience shin splints over the course of their lives, and most don't give this symptom important consideration. Yet for some patients, this condition develops into a very serious pathology requiring immediate emergency surgery and sometimes leading to the death of muscles, irreversible damages to nerves, etc. All initial soreness is the result of an overload or strain of the tibial muscles that are responsible for dorsal foot and dorsal toe flexion. Muscle inflammation, or myositis, is the result of strain in the muscles. Repeated strain of tibial muscles causes excessive swelling. The swelling of muscles, edema, raises muscle tone, decreases arterial blood supply to the tissue and causes pain. The proposed massage techniques are directed toward reduction of muscular tone, swelling, and increase of arterial blood supply. These measures, in turn, will reduce pain. However, reduction of pain is only the first stage of rehabilitation. It doesn't imply that athletes can continue their usual routine. A complete rehabilitation from shin splint trauma includes at least 15 treatments of massage, trigger point therapies, neuromuscular reeducation, and post-isometric relaxation. In the case that rehabilitation is not completed, an individual is in danger of re-injuring the tibial group of muscles. This can result in stress, fracture, or compartment syndrome. All tibial muscles are attached to the tibial bone by connective tissues, including fascia that surrounds muscles and helps transmit muscle powers needed for movement. A forcible load that is applied to tibial muscles is transmitted through fascia to the tibial bone. If such a significant load is applied during re-injury or chronic inflammation of the entire tibial structure, it can cause cracks in the tibial bone. In other words, tibial stress fractures. Re-injury can cause a significant edema. This can make the internal compartmental pressure so great that the blood supply to tibial muscles will stop. In cases like this, if emergency surgical interventions don't occur, the tibial muscles will die. In addition, the compartmental pressure due to edema could be great enough to cause irreversible damage to nerves that innervate the tibial group of muscles. Please take note that shin splints represent the initiation of a very dangerous syndrome. If the development of this syndrome will not be prevented, it can cause serious irreversible damage. Remember that full rehabilitation is an absolute must. Otherwise, you can severely re-injure yourself. A non-rehabilitated pathology can develop into a very serious condition.
Even if pain will be inhibited after 2 or 3 treatments, in order to rehabilitate yourself from injuries and to prevent re-injuries, you must receive at least 15 to 20 treatments. If you don't have time or money for multiple visits to a medical facility, this self-rehabilitation DVD would offer a valuable alternative.
In this DVD, Boris demonstrates techniques for self-trigger point therapy, ice and hot stone applications, post-isometric relaxation techniques, and neuromuscular reeducation. These techniques were tested on thousands of elite athletes, which over the years have proven to be extremely effective in treatment of sports-related injuries and in subsequent prevention of repeated injuries. The proposed techniques could appear surprisingly simple to learn and make so much sense that they might seem self-evident. However, in order to rid yourself from injuries, or to prevent yourself from subsequent repeated injuries, it is extremely important that all the advised procedures were performed in the same sequence and for the duration that Boris requests. If you would like to purchase this DVD, please click the link on the right of this video under Boris's picture.